Good evening, everyone. Thank you for joining us from the Center for Integrative Health and Well-being and ANIRASA Integrative Health and Well-being Clinic. We bring before you the first in the series of the awareness programs. Today, we focus on how do we build immunity against COVID-19 in particular and other infections in general through an integrative lifestyle approach. Briefly, to introduce myself, I'm Krishnamurthy. I'm a physician by training, done my MD in community health, subsequently worked in the field of public health and global health. And for the last 2 years, I've been a part of the team that has set up Center for Integrative Health and Well-being. Brief introduction, Center for Integrative Health and Well-being, as I said earlier, it has two focus areas. One is health and the other one is education. Within the field of health, our focus is integrative medicine with a particular focus on prevention and health promotion, and harnessing the best of what modern medicine, Ayurveda, yoga, and meditation can offer, and help look at health and well-being more holistically. ANIRASA Integrative Health and Well-being Clinic actually is involved in delivery of these clinical services. Just to talk about COVID-19, which is bringing us all together, and I don't want to give you a lot of information because by now I'm sure we all are overwhelmed with information on COVID-19 from various resources. I would like to probably talk a little bit about COVID-19, but then move on to lifestyle a little bit in greater detail. Before we move on, let us take a look at the latest statistics as of today. What is it in terms of numbers of cases and number of complications? Let me just bring you up the WHO website, which almost updates the statistics on a daily basis. You see, as of 7th June 2020, close to 6 million cases and more than 395,000 deaths. If you can go to a particular country, let's go to India, where as of today, it's 246,000 and odd cases and about 7,000 deaths. Let's go to the US, close to 1.8 million confirmed cases and 400,000 deaths. This is an interesting site that I would like you to all visit and explore. If you scroll down a little further, there are statistics specific to regions and specific to the countries as well. Let us go back, go to the India illustration. If here this particular pictorial provides you the number of cases on a day-to-day basis and how on each day what were the number of cases that got added. Let's see, on April 23rd there were about 1,400 cases that got added. Move on to May 25th, 6,000, and more recently 9,000, and overall it is 246,628 cases. That's a lot. Just in about 4 to 5 months, this pandemic has reached about more than 200 countries and close to 6.7 million cases and 300,000 deaths. In this context, today the focus is COVID-19, immunity, and lifestyle. If you see, in a matter of 4 to 5 months, in December, it all started in Wuhan, in China. And since then, a lot of exploration and a lot of analysis in terms of how lifestyle has sort of led to this pandemic, be it the contact with the animals, the globalization, the deforestation, which is increasing the human-animal contact, the changing dietary practices, food habits, the travel, right? I think with such rapidity, if transmission has to happen, I think definitely the connectivity, the travel that we experience today has been responsible. Personal hygiene practices, stress has got a great relation with immunity as well, and a whole lot of lifestyle factors that are resulting in acquisition of COVID-19 as well as progression from the case to the complication and to the death, varied shades of immunity playing its role there. Yes, all these contribute greatly, and these are a part of a routine lifestyle in the modern days today. None of us are spared. And the context of this discussion is what best we can do within our routine, within our lifestyle, to be able to address it to the best possible way and be able to strengthen our immunity from within to be able to tackle these illnesses, these diseases. Coming back to COVID-19, yes, we all are familiar. The transmission was from animal bats to the human. Subsequently, human to human transmission was documented, both through direct contact or through droplets, through the sneezing or the coughing. And how does virus attack? It attacks the lining of the respiratory tract. It binds to the particular receptors on the cell, invades, and then gains entry into the human body. Clinical features, I think 80 to 85% cases show mild features and they recover. Symptoms like fever, tiredness, and cough are noticed. Sore throat, loose stools, sneezing, running nose are also witnessed. About 15% develop complications, and just about 3 to 5% may die. And in Indian context, we see the fatality rates is around 2 to 2.5%. In some countries, it is much higher, up to 5 to 6%. Deaths are particularly observed among elderly and those who have other conditions like uncontrolled diabetes, cancers, respiratory diseases, or other conditions where immunity is already suppressed. How do we manage COVID-19 as of now? I think wherever there are complications, they would need hospitalization, ventilator support. As of now, there is no drug or vaccine that is working. And many trials are being undertaken to come out with a vaccine, and the experts are predicting it won't be until a year we can have a vaccine to be able to protect everyone from COVID-19. As of now, all the suspects to be tested, and if they're positive, need to be isolated, quarantined for 14 days, during which time make sure that they don't spread infection to others. And most important aspect is to adopt personal protective measures and bring about the required lifestyle change so that we don't come in contact with the cases and become vulnerable. So in this context, how do we approach lifestyle from an integrative health and well-being context to be able to build immunity and prevent disease? That's the focus of next few slides. When we say integrative health and well-being, what are we trying to integrate here? I think there's a lot of science and a lot of experience from various fields of medicine, starting with modern medicine, within which there's a separate branch called lifestyle medicine. A lot of research, a lot of studies have happened, especially in the last few decades, with the advent of non-communicable diseases like diabetes and hypertension, cardiovascular disease. Lifestyle has been explored greatly and a whole lot of science has evolved, and that is something that we will definitely harness as much as possible. Secondly, we also look at traditional healing sciences, be it Ayurveda, yoga, meditation. They also contribute hugely to the lifestyle, and how do we pick the best among them and then jointly address a holistic lifestyle? That's the focus of this presentation in the context of COVID in particular and other illnesses in general as well. Specific personal prevention measures, we are all familiar with them. I'm sure all of us have been practicing it very keenly, be it the hand washing, the social distancing, using masks to cover our mouth and nose, avoid touching faces during this time, especially now that the lockdown is lifted in a lot of our geographies. When we begin to work, make sure that we take care of these practices more carefully and continue to watch out on our health, especially those who are hypertensive, those who are diabetic. Make sure that your health is under control, blood glucose, the blood pressure, and immunity is up to the mark. Those who are smokers, do abstain from smoking because smoking and COVID-19 have very strong link in terms of complications. There are a whole lot of other general lifestyle issues that have a play on the immunity and in COVID-19 in particular and other illnesses as well, be it physical activity, be it alcohol and smoking, be it the foods that we eat. Just to spend a few minutes on these important parameters. So nutrition, we all are familiar how the junk foods, the processed foods, the deep fried foods, I think while it's become a part of routine in a lot of our lives, The science has been, evidence has been showing how they're contributing adversely to the cell metabolism and giving rise to these metabolic diseases that we refer to as diabetes or cardiovascular diseases, stroke, and other a group of illnesses, right? And in the context, how do we as well replace them with nutrient, with a balanced diet, with fruits and vegetables and vitamins and supplements? That becomes an important part of the lifestyle change to affect our immunity. Alcohol and tobacco, the growing number of studies have shown how they impact organs, not just one, but multiple organs, brain or the liver, the kidneys, gastrointestinal tract, a whole lot of at the systems level, the immunity as well. And then the physical activity, with the kind of change in the working culture, living conditions, sedentary lifestyle has become a norm. And how do we bring back physical activity? Again, in the context of physical activity, there are those exercises that are aerobic in nature, improve those that improve flexibility, improve strength and tone of the muscles, improve joint mobility. Very often we may pick up exercises that are based on our convenience. In the limited time that we have, we may choose one over the other. But unless we look at exercises, physical activity to address all the 3 or 4 things that I was just talking about, the tone or the strength, the flexibility, the joint mobility, or even the balance aspect, I think is very important, especially as we age. Our degeneration starts in terms of nerves and terms of bone joints and the tendons, and there is a need to really balance all the 4 different types of exercises to be able to achieve that optimal physical activity that is very important. And physical activities also have an effect on several neuroendocrinal mechanisms and immunity as a part of it as well. Well, that is about lifestyle medicine and the modern medicine. From Ayurveda, again, there are very interesting approaches. Well, modern medicine looks at aggregating interventions or drugs for the populations. Ayurveda goes beyond. Ayurveda recognizes that each individual is very unique in terms of their body and mind, recognizes each constitution as unique, and tries to develop interventions and lifestyle interventions very customized, very specific to each constitution. Having said that, at a generic level for COVID-19, I think use of various of these spices, ginger, pepper, garlic, coriander, turmeric, a lot of them can really affect immunity and give that additional protection that we require. Ayurveda often advocates that we prepare freshly prepared food and consume warm food every time rather than cold, the frozen foods. And it says when you prepare a food, finish it within a few hours, eat it when it's still hot. And that's the norm that our Ayurveda physician often recommends to all our clients that visit our clinic. Ayurveda also recommends at regular intervals whole body or head oil massage because they have their own rejuvenating, revitalizing, relaxing effects, and indirectly they have an effect on the strength and rejuvenation and the immunity and the disease control abilities of the body. Again, specific to COVID-19, to see to that the COVID virus doesn't get into the respiratory tract, Ayurveda recommends to us to smear a few drops of warmed, cooled coconut oil into the nostrils. That way it preserves, nurtures the local immunity. At regular intervals on a daily basis, clean the nasal passage using a neti pot with the help of saline or salt water, because that again moisturizes the nasal passage and enriches the local immunity and prevents the contact of the virus with the system and prevents the entry of virus into the cells. These are some excellent recommendations that Ayurveda comes out with. Comes to yoga, I don't think I need to say much over the last few years. I think with the advent of International Yoga Day, there's a lot more recognition and awakening of the yoga, and yoga is increasingly adopted as a part of a routine and lifestyle. Interestingly, this month, June 21st, is International Yoga Day as well. And again, specific to COVID and these infections, I think there's a number of yogic practices. Specifically, yogic breathing can improve quality of inhalation, the exhalation, and revitalizes the whole body. Alternate nostril breathing, or the Nadi Shuddhi as it is referred to, can help improve oxygen intake and eliminate carbon dioxide more effectively. Particularly the Kapalabhati improves the quality of breathing and improves digestion as well. I just make a note at this stage. While yoga is definitely increasing, I think more and more people are adopting it. We see that yoga is also approached a very limited way, where for a lot of people, yoga is stops at a physical level, and yoga is done as a mass, large group activity without really giving consideration to individual requirements in terms of body, mind, constitution. For each constitution has a different requirement in terms of the number and in terms of the frequency in which the yoga has to be done. I think if without considering that, we may not be able to harness the benefits fully. That's where the integration of Ayurveda yoga become really important, when we really assess a particular body, mind, constitution and the lifestyle, and then develop specific yoga modules for that individual. That's where we can reap maximum benefits. And that is where our yoga instructor comes into picture. She often discusses with our Ayurveda physician for each client and comes out with a very customized yoga practices in terms of asanas, in terms of breathing exercises, and then helps the client take one thing at a time in a very gradual way. Make sure that the clients pick it up and also practice it rightly. That's where this one-to-one coaching becomes very important. The direct supervision, direct attention, helping clients adopt it and practice it the right possible. Coming to meditation, we particularly advocate Heartfulness practices. Heartfulness is a non-profit organization, provide free coaching in Heartfulness meditation practices. A lot of research has been undertaken and which has documented effects of Heartfulness practice on improvements in the levels of well-being, reduction of stress, improving quality of sleep, reduction of blood pressure, regulation of autonomic nervous system. Just to make a mention of autonomic nervous system, that deals with the nervous system that governs all the bodily activities in a very automatic way, be it the functioning of the heart, the lungs, the kidneys. And this has two different parts called sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system prepares the body to face stress. That's when heart beats faster, lungs expand and contract faster, blood pressure goes up. On contrary, there's a parasympathetic system where the whole body is under relaxation. The blood pressure comes down. We take more gradual breaths and blood glucose also comes down. Both are important to be working in optimal level in a balanced way so that body is kept active, manages stress effectively, at the same time withdraws when there is no more stress outside. Heartfulness practice is shown to regulate the autonomic nervous system, and that way keeping the body in a paused, in a calm state. This comes in handy in a number of ways to control blood pressure, blood glucose, come up with the right behaviors in terms of lifestyle, and a whole lot of benefits at a physical and emotional level. And of course, there are many more benefits at a much deeper level that are harnessed as well. Well, friends, that is in brief about this integrative health and well-being lifestyle, integrating modern medicine, Ayurveda, yoga, and meditation. In the context of COVID-19, we feel all the four are very important. This COVID-19, whether we like it or not, it does affect us at many levels: physical, mental, emotional, at a much deeper level. That's where having an integrated approach can really help us stay fit at every level of our existence. And that's what we would like to sort of bring out to the world. In this context, what are the services that ANIRASA Clinic offers? We have various sets of programs. For the beginners, we have initial awareness programs. We simply call them Integrative Health and Well-being Explorers Program. Those who are keen, those who want to know about it. For example, this particular program is just to give you some awareness, to evoke that curiosity and evoke that interest. Subsequently, we have 3 days to 5 days. It can extend beyond. It's filled with awareness as well as practice programs. The clients are exposed to particular Ayurvedic and yogic and meditative practices as well. We call it Advocates Program. There's a much longer duration program called Awareness, Practice and Change Programs. We call it Integrative Health and Wellbeing Champions Program, where our teams work with the clients for a long duration of time, as much as the clients would require to be able to make a permanent change in their lifestyle, in their routine, and emerge as champions. We offer group sessions as well as one-to-one personal sessions. And a lot of these programs start as a group sessions, then they branch out into one-to-one, because in the group sessions, we can only attain so much awareness, so many generalized yoga asanas, so many generalized breathing exercises. But subsequently, we need to follow it up with very customized one-to-one program, both in terms of Ayurveda and yoga, and then help them adopt it at the pace that the clients would like to walk. Sessions are conducted in person as well as in remotely. Of course, till the time of COVID lockdown, we were operating largely in groups in person, but now we are dealing with the clients mostly remotely. With that, we come to the end of our session. I think the attempt through this session was to just give you a glimpse of what is an integrative health and well-being lifestyle, how it can impact immunity in the context of COVID. Again, when we look at integrative health and well-being, how does modern medicine look at lifestyle? What does Ayurveda do, and yoga and meditation? When we bring them all seamlessly together, the clients can benefit that much more. When we bring them together, yes, one is learning, one is practicing, and then comes the change. It takes a while. That's where we as a team are available, very happy and interested to work with you to be able to help you make that change permanently and emerge as a champion. That's our wish and our dream for each of you. With that, I will come to the end of the session. What we would like to invite all of you is to visit our website and go through the details. Stay in touch with us via YouTube channel. Please subscribe and stay connected. We would like to stay in touch with you as well. We are an Ayurveda expert. We have a yoga instructor, a meditation expert, psychologist. We have a cognitive researcher. I myself come with a public health, medical research background. We have somebody from technology background, education. Whole enthusiastic team out there, all committed to developing these tools, methods, programs, so that we can offer to the world out there and help them to embrace their lifestyle in a very gradual way to be able to make a permanent change within their context. That's what brings us, and thank you once again for joining us, and we look forward to stay connected. If you have any questions, I'll be more than happy to take them. I know the time is running out, but we will stay connected, and feel free to write to us to the email ID you just saw. Thank you once again, and good day to those of you who have joined us from abroad, and good evening to all those who have joined us from India. Thank you so much once again.